sometimes I know I suffer with some lower back pain, and I assume that that's quite a lot of what you deal with. There must be quite a lot of people out there with sort of lower chronic back pain. What are the differences that separate the kind of the chronic back painers from like the more acute problems that might present themselves?
So yeah, I mean, low back pain is probably the most common presentation in clinic, and it certainly comes back to this idea of figuring out how much of it is somatically driven. You know, if you've been hit hard playing rugby and you felt something go, then that's one thing. If you've sort of woken up in the morning and and the pain is there, then that is something else. It's often so looking at how the pain has come on is an interesting, but then looking at beliefs around it. Is this pain going to stop me from working? That's a common one that I see. Is the pain going to get worse? Am I going to end up in a wheelchair? These are sort of fears that people have.
Wow.
And can really mess with, if you think your pain that you've woken up with in the morning might sometime in the future lead to you having to be dependent on a wheelchair, then you're going to feel your pain way differently to somebody who's woken up in the morning and thought, oh, I've got a bit of a niggle this morning, it'll be okay. So dealing with those sort of expectations, and I often find that severe chronic pain is associated with fear of the future. So dealing with that is important. And the other thing that often ties in with it is protective strategies. So you often see things like people trying to keep a straight back. One thing I often do is ask people to pick a book up off the floor. And generally there's two strategies. People either bend their knees and keep their back really straight in a health and safety sort of perfect way, or they'll bend their back without really thinking too much and pick this lightweight book up. And I much rather see the second. And often people are surprised when they've had a sort of bent knee, straight back strategy, and they say, oh, but everyone says bend your knees, not your back. And I say, yeah, and I wonder why, because there is zero evidence to back that up.
That's interesting.
Yeah, there is there's a really well-funded health and safety industry and there is some evidence about picking up really heavy weights and how one should do that. But interestingly, if you go on YouTube, and it might be interesting to do this once you've finished watching this video, and Google deadlift world record, and watch how those guys are picking up almost a ton, you'll see them lifting with bent backs, not straight backs. And you think, well, what the heck's going on there? The evidence on heavyweight lifting is that if people start to lift in a different way, so if you are used to lifting with a straight back and then lift with a bent back, then you might get injured. And I think that's probably true. And if you are used to lifting with a bent back and then lift with a straight back, I think that's like you're likely to get injured. And I find this often to be true. And I think this speaks largely about adaptation. Your body adapts to what you do with it. And this ties in a lot with, so one thing that's really common is people will come in and say, I've been deadlifting in the gym and then I got tired and my form went, and what that means is their back bent, and I always have to challenge them to what does that actually mean, because I don't know what good form means, because there is no evidence to back it up. What they mean is their back bent and then they'll say something went, and so they're blaming it on their form, and I'm thinking, well, no, you've got 100 100 odd kilos in your hand, and you're now lifting in a way that your body is not used to, and you're doing it whilst tired. You know, there's no surprise that your back is gone, and maybe that's because you're lifting, you know, in a different way. It's not because your form's gone, it's because you're lifting in a different way. It's not because there is no good and bad way other than the way you're used to.
Huh. Did not know that.
Yeah.
That's very interesting, actually.
So yeah, so these sort of beliefs about how you should move is a really key thing that you see in chronic pain type stuff, and digging into that, and you know, because there are so many of these things that people do, sometimes consciously and sometimes subconsciously, and that is really difficult if someone doesn't even know that they're doing something. You know, are you sitting differently at your desk because of some belief you had 15 years ago that has now manifested as some sort of unconscious belief? It's really difficult to dig those things out, and can take a bit of time. But yeah, it's those sort of things that I look for, and often when you get lucky, you can put your finger on something, and you can have immediate, life-changing effect on people, and they'll come back the next week and say, yeah, I had a vet in the other day who was, she'd noticed, we talked a bit about breathing, and she'd got sort of tension in her back, and she'd noticed that every time she picks up a cat box, she holds her breath, and that had led to a rigidity in her pattern, and this was we think probably due to some sort of bracing idea, and actually what we've got to do is, you know, cats probably weigh plus the box 5 or 6 kilos, so actually it's not a massively heavy weight. Relaxing, and at the moment she's just breathing more gently into her tummy and moving more softly, and she came back saying, well, that's 100% gone. Yeah.
Wow. And just because...
Yeah.
Wow. I suppose, I mean, that's an interesting thing all by itself, because that, of my experience of like gyms and things like that, they always tell you to kind of regulate your breathing depending on what you like. If you're pushing the weight up, you blow out, if you're pulling it down, you breathe in, and that kind of thing. Like,
yeah, they never say hold your breath though, do they?
They don't know. That's quite interesting, because you wouldn't immediately think to link breath that way.
And I think there is something in the idea of exhaling when you for maximum performance. You know, that is a real thing. But yeah, somehow it seems to get confused with this bracing and holding breath. That's the real enemy. If breath is controlled in out, I'm not a massive. I don't see that as a massive problem. You can get paradoxical breathing where people are breathing back to front, but again, that's not as big a problem as the bracing and holding it type idea. And this ties in with stress as well. You know, when people get stressed, they tense up, hold their breath as an instantaneous thing. And that often, I think, ties in with this tension in the shoulders type thing that people often talk about with stress, and often find that breath through the tummy, slowing things down a little bit is a really, really powerful thing.
Yeah, definitely. I mean, just the things that we've gone through in my time seeing you, and my further reading and practicing around things like mindfulness and breathing, breath control, as well as for part of my job, is like it does change how you react to situations. So when I first came to see you, before I'd even started looking into any of this, it would have been very. I think a lot of what I came to you with was blockages, and that was a physical one where I'd spent so much time bracing. I think is based on what you're saying, caused an issue. Like everything kind of tensed up, and we had to kind of work everything out. And you know, we're still getting there. But at the same time, that linking that with an exploration of the psychology behind the pain and the reasons why my shoulders are always up here, and then linking that again with the breath control, and then just literally try it at home if you haven't already. Because if you feel stressed out and you take one belly breath, not like in your ribcage, just down here. If you feel it down here, everything starts to feel better immediately, because you're not going. You're going. I'm breathing here.
Well, that's a really interesting idea, and that's something else that I talk to people about. Is everything starts to feel better when you take a breath through your tummy, and what you're describing there is brain following body. So quite often when people talk about stress, they will talk about I got stressed, and what they mean is they got stressed in their head, and then my shoulders tightened up, so there's a clear pattern of one following the other. What people very rarely talk about is the other, which is brain following body. Did I say that the wrong way around first time? So brain first, body second is the way that people often describe it. I got stressed and then my body tightened up. But the brain following body, if you relax your body, then your brain will relax. The common one that people do understand as well is if I hump my shoulders and go down, then I feel down. If I look up and face the world and smile, then immediately I feel better. And this is brain following body rather than the other way around.
Yeah.
I think I've confused the brain body, but you get the picture.
Yeah.
The two are actually so interlinked. I find it very difficult to think of them separately. And you used the phrase earlier of blockages as well. And I think that is what I often look for is blockages stopping the link, the healthy linking of the whole body. That is a phenomenon, and whether that is in blockages in belief or in movement pattern or in avoidance because of pain. That's what I think my job is looking for those blockages.